Coming up in today's COVID-19 update, there are 20 new intensivists to give support at the Infectious Diseases Hospital at Liliendal. And Minister of Health Dr. Frank Anthony says requests for public social events will be considered on a case-by-case basis. Minister Anthony, thank you so much for joining us today.
Well, thank you very much for having me.
Yes, sir. So government has ensured that there are enough vaccines, and I wanted to ask, since our last vaccine arrivals, have we seen an uptake in vaccination, and could we also get a breakdown of the regional figures?
Indeed, we have been seeing a steady set of persons coming to get vaccine. And just yesterday alone, we recorded one of the highest numbers of persons coming for vaccines. We had 5,505 persons who received vaccines yesterday. Um, in terms of the first dose, we had 2,942 persons. And in terms of second dose, we had 2,563 persons. So this is one of the best days we had in terms of vaccination, where we were able to immunize at least 5,505 persons. So it was a good day yesterday. Regionally, in terms of first dose, Region 1 is now at 72.9%, Region 2 at 51.6%, Region 3 at 57.2%, Region 4 at 63.7%, Region 5 at 59.5%, Region 6 at 65.2%, Region 7 at 61.5%, Region 8 at 39.7%, Region 9 at 69.1%, and Region 10 at 21%. So just looking at these first dose numbers, we still have a long way to go because on average, as I said, it's 59.7% for first dose, with Region 10 having the lowest amount of persons who have received their first dose vaccine. And that's quite unfortunate that we're still having a slow uptake in Region 10. As I keep repeating, when the Delta variant gets here, unvaccinated people are going to have a much difficult time. So I really urge the leadership in these regions to encourage the citizens within their communities to get out and get the vaccine. So we have 56 persons who came into Cuba. This is part of the new brigade. Some sections of the old brigade has left. They went out over the weekend, and they have new doctors that came in to replace them. The composition of the new doctors, we have changed that a little bit because we try to prioritize where we have the greatest needs right now. And the greatest needs would be in the management of COVID-19 patients. We need people who can operate our intensive care unit. And as you know, we have expanded that unit to have now about 45 beds with ventilators and monitors and so forth. So when you have a patient in the intensive care unit, it's quite an intensive process, meaning that the doctor-nurse ratio per patient is almost like a one-on-one ratio. So you need a lot of people to be able to monitor these patients. We have been using local staff, but in addition to the local staff, we thought it would be best if we can complement it with the new doctors that are coming in from Cuba. And so we have asked them to send us at least 20 intensivists. These are persons, doctors who would be working primarily in the intensive care unit. They understand how to use things like ventilators and so forth. And they would be ideal to work in this particular unit. So that's why we've asked for these doctors. In anticipation of a surge of Delta variant where you can see a lot of admission coming very quickly, we thought that this would be the best use of our resources and to prioritize having a skill set in the intensive care unit. Each one of those requests would be considered by the task force on a case-by-case basis, and depending on what the epidemiological situation is at the moment, a decision would be made. So in some cases, if the cases are low, perhaps we can consider it favorably. But if we see an upsurge in cases, then we may not be able to grant such permissions. So it really depends on the amount of cases we have and what is going on. And I guess if we have more people getting vaccinated, well, then we would be able to host these events in a much safer environment. But we are far away from herd immunity, and that's our aspiration, to get to herd immunity as quickly as possible. And we can only do that if more people come forward and take the vaccine. As of yesterday, we now have 290,779 persons who would have received a first dose of the vaccine, which approximate to about 59.7% of our adult population. In terms of second dose, we've had 149,691 persons who received the second dose of their vaccine. So we now have approximately 30.7% of our adult population being fully immunized. Once you get your COVID vaccine, the COVID vaccine is designed to ensure that you develop antibodies. There are no contraindication to say that you shouldn't have anesthetic. So there's nothing to be fearful of.
Well, that's it for today's COVID-19 update. We've just spoken with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.